The South Shore's Morning News rolls on. Great to have you here. And once a month, we have our CROI Health segment on WATD with the CEO of CROI Health, Renee McInnes. She joins us in the studio once a month, and she is here today. Renee, good morning.
Hi, Rob. How are you?
Doing very well. How have you been?
I'm good. Beautiful sunny day, and
Certainly
warm
is.
weather's coming.
Yes,
Different from last month when we were here.
I know. We are excited. I'm looking forward to the months ahead.
Me too.
That's for
Me
sure.
too.
Well, once again, you have brought a special
Yes,
guest with you.
Of course I have. So Phyllis Shea, who's been with CROI Health, formerly NVNA and Hospice, for over 20 years, and she's a physical therapy assistant and community, I always say this wrong, so community outreach coordinator.
Yes.
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 Phyllis, welcome.
Renee, thank you so much for having me
Yeah.
today. I really appreciate it.
Absolutely. So tell us about the programs that you provide, and there's so many, in the community for CROI Health, the 27 towns in which we cover.
Absolutely. Well, a funny story. When I started with CROI Health, we were actually Norwell Visiting Nurse Association. So I'm talking way back when I started. And as my job changed, I became the community outreach coordinator. And that entails me getting into the senior centers, local assisted living facilities. Some of my programs are called Rusty Hinges. They might be for like an arthritis program. Another one I have, which someone came up with a great name for me, was Get Physical with Phyllis. I do that over in Scituate. So I just happened to be with somebody that was in marketing, one of my patients' son-in-laws, and they thought that would be a great name. So here I am in Scituate doing Get Physical with Phyllis. Another exercise program I do is Stretch, Strength, and Balance. So that consists of weight training, therapeuting. We also use just general core strengthening and lower body strengthening, and of course, balance activities. And
Wow.
I feel like the best thing about that class is watching somebody come to my class at the beginning and holding on with both hands because they're really unsure of themselves. And then as they progress, maybe they're only holding on with one hand, and then maybe they're holding on with no hands, and you can really see the joy in their face that I've accomplished this and I'm safer on my feet now.
Yeah. And I think one of the really valuable things about doing these community outreach programs, whether it's in the Council of Aging sites or it's an assisted living or an over 55 community, is that not only is Phyllis providing them with, like you said, an arthritis program or balance program, but as a resource for people, because people have questions about navigating healthcare.
Absolutely.
Yeah.
So they can ask Phyllis, oh, I have a question about this. Or so also maybe speak a little bit about the dementia practitioner program that we have
Absolutely.
within the organization and how your outreach is going to work there, leading that initiative.
Absolutely, Renee. So I'm really proud of this. I came up with a program. It's called Calm, Cool, and Collected, a Caregiver's Survival Guide.
Ooh.
Because, when someone's a caregiver, it's really the most difficult job in their life, but sometimes it's usually the most rewarding job in their life. But you have questions. Where do I go? When do I know when it's time to receive care? And I talk in that class about getting a support circle together and really knowing who can be there for you at what times. Is there an emergency? Because caregivers don't think about what happens if something happens to me
Right.
in the
Yeah.
middle of the night and I've got my folks home with Parkinson's or dementia and they can't be left alone. So how can I create that support circle and really have that behind me? So that's one of the programs I'm offering right now, and that is for dementia and Parkinson's. I take that to local support groups, and I was able to see a support group in Scituate, and I had over 20 folks in that class.
Wow.
And it really meant a lot to them just to hear some simple tips that they can take to just get through the day and survive the day.
That's very important.
It
Yeah.
really is. It's really amazing to see how much people appreciate that,
Yes.
because they're kind of lost along the way.
Of course.
Because it's an ever-changing diagnosis. It changes all the time.
Yes.
Right.
Yeah. Just when you might start to get used to a pattern, the pattern can change.
Yep.
You know, and all of a sudden,
100%.
yeah.
And we get calls all the time within the organization just seeking help. And it's usually in a crisis, right?
Yeah.
So what we're trying to do is offer more education within all the communities so that people know they can call us or they have a resource with Phyllis. And the support groups are so important. People feel like they can go and it's all confidential. So whatever they're asking or saying in that room stays in that room. And I think that's really important to people.
Yeah. And these programs, and I know we're going to talk about, right, how people can take them,
Yes.
and there's some
Sure.
things coming up too, right?
Yes.
Absolutely. I actually have a program coming up in Marshfield on April 22nd.
Okay.
It's called Watch Your Step. It's a fall prevention program that I'm offering at the Marshfield Senior Center. You can call the Marshfield Senior Center directly and get signed up for the program. It's a great program for older adults because 1 in 4 adults fall.
Well,
each
yeah,
year.
I was going to say, what is the most
It's
common,
it's 1 in 4 adults.
you know, that
Yep.
we have heard,
Are
you
at
know,
risk for
I
a
think
fall.
we all have stories about,
Yep.
you know, a friend or a relative
Yeah.
of someone and their condition worsens, and you'll say, well, what happened? They
Right.
fell.
Yeah.
And then,
Yep.
you goes from there. So if you could prevent the fall, you
Absolutely.
could prevent a bunch of other things.
Absolutely. I
That's
actually
right.
spent the winter going around doing Watch Your Step, Here Comes Winter. And at the
Yeah.
end of the winter, I was so glad I did because I talked about safe snow shoveling, which obviously we know
Yeah.
we all needed to do that this winter.
Yeah.
So it was a really great program for the winter for everybody because it really
No,
was
yeah.
able to give them some good tips to keep them safe.
No, I always tell the story. The first time I didn't realize how fast a brick walkway glazed up, and you know, I mean, thankfully, you know, I'm okay. At the time, I was younger, but yeah, I'll never forget. You know, just all of a sudden going up in the air, my bag
Right.
flying through, and everything
Right.
coming out, and then you end up, you know, and I could have, you know, seriously injured myself. and,
Absolutely.
you know, but that's the kind. I didn't even think about it. You know, at the time, I just went out and was
Right.
going too fast.
And the definition of a fall is an unintentional contact with the ground.
Oh, that was
And that's the
it's
first
definitely
thing I tell the
unintentional.
classes when I get there is, you know, let them know that
Yeah.
Right.
this is
Thankfully,
what it's
there
all
were,
about.
There were no Ring cameras to watch at
Right.
the time. Yeah.
You'd be famous.
And wearing appropriate shoes, and there's so many tips.
There's so
you
many
know.
things, and
Yeah.
I think, you know, probably, you know, knowing that, I imagine. Well, you work, Phyllis, you know, with older people. Is it that it's hard to think, first of all, that A, I'm fragile, or B, that
Yeah.
that, you know, some of these abilities, we start to lose them, that you don't sometimes feel it or see it coming, right?
Absolutely. And so on the other side of my programming, I also work for CROI Connect,
Yeah.
which is our private division. And I'll let Renee speak a little bit more
Yeah.
to that.
Okay.
But so I go into people's homes. I've been with some of these folks for 5 to 10 years. Some of them I've been with for 12 years. And these folks, as their abilities change, you're not only helping the person, but you're helping the family because it's the same as the dementia programming. You know, these folks are changing, their physical abilities are changing, their mental abilities can be changing, and the caregivers don't know sometimes
Yeah.
how to fix that or how to help them.
It's your own personal trainer coming
Yeah.
out to your house to make sure you continue with the exercise program and continue with the falls prevention after they've finished with what the insurance company would pay for, right? So
Exactly.
it is part of our private pay division, but many people just want that program to keep moving.
That's
So
so important.
important.
So important. Okay. CROI Connect and some of the private services we've talked about, and also Phyllis Shea. You can learn more about what she does, and certainly go to that program, April 22nd in the Marshfield Senior Center?
Yes, April 22nd.
That'll be a good one to sign up. Watch your step, because it is so important. And I imagine, you know, for an individual, I would feel that it would be difficult just thinking for myself that most people that, you know, that I might not be able to do this myself, or I might need help.
Right.
You know, I don't need a cane or some kind of assistance. You know, I'm gonna
Right.
go out there and still
No.
do like I did when I was.
We all think
20.
we're invincible.
Yeah.
Absolutely. And nobody wants to admit that they need a cane. And sometimes
Yeah.
it takes somebody to tell them.
I know.
It's going to
Yeah.
improve your mobility, not take it away.
And
Yeah.
fall prevention is huge across the healthcare system because it also it's very costly for the healthcare system when you
Yeah.
fall, break your hip, or fracture something else, and now you're having surgery and you're in the hospital. The recovery takes longer as we age, right?
Yeah.
So it really is something all of us want to prevent.
Yeah.
So to speak to that, Renee, by 2035, I can't believe we're saying 2035. I'm sorry, by 2030,
Yeah, it'll be here sooner than we know it, right?
Medicare costs will be $101 billion just for falls alone.
Just for
Yeah.
falls.
Yes, by
I
2030.
believe it.
Here we
Wow.
are in
That's
2026.
insane.
That's 4
Yeah.
years from now.
So it is
101
important to know
billion.
about it. Are there any just kind of things we can do every day to kind of stay strong? I mean, is it exercises? Is it that kind of thing?
It-
Because I know sometimes, you know, we get a little comfortable, maybe start sitting down more. No, it
Absolutely.
happens, right? Are there things that we can do?
Absolutely, absolutely.
What would
And-
you recommend for anybody listening right now?
Well, I would always recommend to take advantage of your local senior center.
Yes.
Because
okay.
especially Marshfield is amazing. The programming at Marshfield is just unbelievable. They have a program for everybody. And my classes are available for all abilities. If you need to hold on to the chair, that's okay. You can still do my class. But getting out there, getting into an exercise program, having some socialization with that as well, that's huge,
Yeah.
especially since COVID. I believe
is.
that socialization is so important. And even if walking is your thing,
Yeah.
you know, anything you can do to keep moving. One of the other programs I do is called Get Up and Move. So that's a great program, and that's when I talk about why you need to exercise, who needs to exercise, and when and how.
Great stuff.
And everyone needs to exercise.
Absolutely.
Absolutely. No, I know. This is for all of us.
Absolutely.
Right, to do that and to prevent future incidents. Well, we've been joined this morning. We've had Phyllis Shea in studio this morning, and of course Renee McInnes, CEO of CROI Health, as we have the CROI Health segment once a month on WATD. And of course, Renee, people can find out more. Give out the website.
Yes, CROIHealth.org.
CROI Health. That's
CROI Health.
CROI.
CROI, yes.
Thank you, Renee and Phyllis. Great to
Thank
see
you.
Thank you so much, and I can be reached at pshea@croihealth.org.
P. Shea, okay. P. Shea at croihealth.org. Thank you, Renee and Phyllis.
Thank you.
Thank you, Rob.